Really. The first was we, through another family member, talked to a person who had had a transplant here, had a liver transplant, and she kind of took us through from start to finish, and we really liked the things that she said and the way that they handled her before the operation and after the operation. So that referral really helped us. The second thing that was important to us is that the other option in the area is still a teaching hospital, and it just seemed like, and there's definitely a need for teaching hospitals, don't get me wrong, but it seemed like this was something that was so important to us that we wanted, we didn't want that type of an environment.
What I think patients will see when they come here is they'll see people that are very good at what they do and that are very caring. They will not feel rushed, and I think that's important. At a lot of big programs, there's just so many patients that there's just this sense of rushing and you know, a frantic pace. You don't get that here. You're not going to feel like just a number.
All my patients have an excellent experience at Porter. They have confidence in the physicians that have been taking care of them. They're very comfortable there, and they feel that the nursing staff is very strong. They feel the clinical coordinators are very strong. They feel that they get their questions answered. I think it gives more individualized care. I think a smaller, private setting program individualizes care for the patient and individualization of the care that they may not be able to receive in a university setting.
You know, at Tulane we did 230 transplants last year, and I was seeing all those patients. Here we do about 50 to 100 a year. So just based on that, I feel like I have a lot more time to spend with the patients.
I feel very comfortable referring my patients to Porter and like my patients to go there because I feel the communication between the physicians that care for the patients at Porter and our practice is excellent, and that is very important for their ongoing care.
Having worked at university and having worked here, I think that there are several very important differences. We are not-for-profit, faith-based, focusing on patient care.
We certainly care about the patient first. We care about the patient second, third, and any moment they are in our organization. It isn't all about payment, it isn't all about bottom line. It is about the healing touch. And I do believe that when you combine our nonprofit status with our faith-based heritage, really brings a very powerful equation to the healing ministry.
I also really enjoy the fact that it's a nonprofit hospital because all the money we take in is spent on patients and patient care. It doesn't go to stockholders. Centura has really committed to making this program great and has given us all the resources we've asked for. For example, at Tulane, we were one of the first programs to do the laparoscopic donor nephrectomy, meaning that instead of a big incision to remove a kidney from a living person, they just use little cameras. Well, I came here and guess what? They do the exact same thing here. So this is just as advanced technologically as any place I've worked.
Every dollar that's produced here through the services that we provide go back into those services, either in new programs or technology replacement or staffing, so that we can better serve the patient.
You can be who you want to be. They're not too far if you believe. Reach for the stars.
The three surgeons at the Porter Transplant Program are three outstanding surgeons, specifically specialized in renal and liver transplantation. They are exceptionally well qualified and offer outstanding medical care.
What I learned about the doctors is that they're probably, some of the pioneers in their field. And interestingly, the person who referred us over here originally started at the other program and then moved over here just to follow that doctor because of the experience that he had had.
The three surgeons that are here at Porter Transplant Service are I think stack up against any transplant program that you could compare it to around the country. All three are well trained in major medical centers, and when two of us are working together on a complicated transplant, I think we provide one of the best technical options for